Hello, everybody. So I'm a medical doctor in my last year of residency training. I'm currently working at the Family Medicine Residency of Idaho down in Boise. And I have been in training now for the last 7 years learning how to save lives. In the next 10 minutes or so, I'm going to tell you how to do that exact same thing. So to start off with, I'd like you to picture yourself in your favorite restaurant or perhaps any public place, really. Out of the corner of your eye, you notice an elderly person clasping at their chest, then they keel over on the floor. Is anybody anxious? I'm anxious, and I do this all the time. Now, something obviously needs to be done in this sort of scenario, and fortunately for us, there's been people thinking about this long before this scenario actually really ever happened. You want to do things like dial 911. Everybody knows 911, right? That's a good number. And do things like check for a pulse and see if that person lying unresponsive is breathing, and if they don't have a pulse, not breathing, start thinking about doing CPR, helping them breathe. So this scenario that I've shared with you actually is something very similar to something that happened to a gentleman that I take care of in the clinic last year. I'll call him Gus for the purposes of this conversation, although that's not his real name, spoiler alert. To give you a mental image of Gus, he's a very slender fellow, has a beard about 2 feet wide and 3 feet tall. And when he stands up, it's like he unfolds to 6'5". So Gus has been a smoker for decades, and that gave him severe lung disease. And one day last year, that lung disease was acting up in a bad way. So bad, in fact, that it caused his heart to stop beating. Gus died. Fortunately for him, before that happened, he had called the paramedics to his house, and when they found out that his heart stopped beating, they immediately started doing chest compressions. They rammed a tube into his throat to help him breathe. He was brought urgently to the hospital where he was given doses of adrenaline and shocks to his heart. And after a long and harrowing resuscitation attempt, a heartbeat returned. We brought Gus back to life. People in residency have been asking me a lot of questions. Are you really old enough to be working here and doing that? Have you done that before? My favorite response to that question is no, it's my first one. But one of the other things that people ask me, my friends and family for the most part, they say, Scott, how is saving lives going lately? And I think that this image, this story that I've just shared with you about Gus, is the type of image that they and that we all have when we think about what our healthcare system is up to, this business of saving lives. But if you've been paying attention at all in the last 10 or 15 years, you've also heard that our health system and our health is failing us. We spend a lot of money on health, more money, in fact, than any other country per person in the world. Healthcare expenses are the leading cause of individual bankruptcy in our country as well. But despite all of this spending, we're not doing very well with respect to our health. A World Health Organization report released in 2016 ranks the United States as 37th amongst all countries over the globe in terms of overall health. It seems that we have become adept at resurrecting the dead, but do not know hardly anything about helping the living to stay healthy while they are still alive. And this tells me that we need a paradigm shift in how we think about saving lives. I'm going to talk to you about the research that leads me to this conclusion. Like many good things, this research starts with pie. So these researchers for the past decades have been trying to figure out and investigating which factors impact our health as individuals and by extrapolation, our health as a population. They call these factors the determinants of population health. And they break these determinants of health into various categories. Excuse me while I write 4 words up on the whiteboard. And for those of you way back there, I'll be talking through them as well. You can cue the background music. No, I'm just kidding. Here we go. Okay, so the first category that they talk about, I've written genes up here. By that I mean the factors that are woven into our DNA, the bodies that we are born to, the health that we can really not do anything to change, those sorts of genetic factors. I've also written behavior up here. So our personal behaviors that have relation to our health. Your diet, your level of exercise, maybe alcohol consumption or smoking. In the case of our friend Gus, one couldn't help but think if he was able to stop smoking at all in the last 40 years, maybe his lungs would not have gotten so bad. Maybe we would have never been talking about this whole episode in the first place. Another category of the determinants of health would be those social, economic, and environmental factors that impact our health. Where one lives, level of income in the household, level of education, air quality in the environment that you live. All of these factors play into our health as well. And then I've wrote or abbreviated medical care up here. You're probably wondering, like, this guy's a doctor, is he going to talk about medical care? So the last category, the medical care, and that's kind of a two-part ordeal. One being whether or not one has access to care. Having health insurance, being able to access care is actually associated with a decreased mortality risk before anything else. And then once you're in care, when you're in the clinic or the hospital, the quality of that care as well. So I've left the pie unsliced because I wanted you to consider for just a moment, if you were the one slicing it up, how do you think that each of these relate to each other? Which category do you think is the most important as far as the determinants of our health? I hear a lot of different answers out there. That's perfect. So to start off with, I'll tell you that genes, our genetics, make up a relatively small amount of the overall health as a population, and realizing that for an individual that might be a different story, but as a population, a relatively small amount, somewhere in the order of 10%. And when you look at behaviors, actually a relatively larger amount in the realm of 25%, leaving us with the socioeconomic factors and the medical care. And this is humbling for me to admit as a doctor, but the medical care actually pales in comparison to those socioeconomic and environmental factors. So if you were designing a society that encouraged its members to lead healthy lives, how would you be organizing your priorities if I just gave you that information? If you were the one spending the $3 trillion that we spend on our health every year, what would be the first item on your budget list? I know that for me, actually, my first dollar wouldn't be on this stethoscope and the medical care that it represents. I mentioned that we need a paradigm shift in how we think about saving lives here, and I propose that we call that paradigm shift saving lives in slow motion. Saving lives in slow motion. What I mean by that is addressing these sorts of factors and keeping people healthy before they ever have to start taking a bite out of that pie. Sorry, that slice of the pie. Saving lives in slow motion actually means a lot of different things, and I can give you a couple examples. It might mean decreasing our obesity and our smoking and our addiction rates here in this country. It might mean a wellness initiative in the workplace or paid maternity and paternity leave. It might be building a new city park or organizing your community or your city in such a fashion that was safe and encouraged people to get outside and be physically active. It might be walking to the bus for work instead of driving your car. In the medical field specifically, it might be focusing more on primary care rather than on expensive procedures. It is these things and many other things. I would be here for a long time talking about them. But in short, saving lives in slow motion is a long list of things that we probably should have been doing for a long time. Now, I'll also tell you that there are barriers to saving lives in slow motion. For one, it can be hard to pay for or hard to convince people to pay for when you're not going to be seeing results in an initiative in this sort of vein for years or even decades to come. Saving a life in slow motion is not glamorous. It's not that sexy. It's not going to get you on Grey's Anatomy or the next episode of House. And saving a life in slow motion doesn't really make doctors or hospitals millions of dollars either. But I am convinced that saving a life in slow motion is our way forward if we're going to improve our health and fix our broken healthcare system. It would seem that those behaviors that I just mentioned in this day are actually the thing that is overcoming us. We are doing open heart surgery for $50,000 rather than helping one to control their weight or to stop smoking long before the heart attack, long before the surgery ever needed to happen. This might be motivating to you. You might be asking yourself, what does this have to do with me? Maybe I don't fit very conveniently into this pie with some numbers scribbled up there. And if you're asking yourself, how do I fit into this whole discussion? I think actually that you would be the best person to tell me how you fit in. We all as individuals need to take a role in terms of our health as individuals, but as a society as well. And so I'd like you to think for a moment about your sphere or spheres of influence where you sit right now. Maybe keep them to yourself just a little bit. There's a lot of people here in a close space. You might be an elected official, in which case saving lives in slow motion for you might be being cognizant of how your decisions impact the health of your community. You could be a business leader, and maybe that means enacting wellness in the workplace initiatives, improving your employees' productivity and health at the same time. You might be an educator, in which case your role in this discussion might be introducing concepts of health into whatever subject matter you find yourself teaching. You might be an influencer in your household, in which case setting an example of what it means to live a healthy life might be the perfect and the right thing to be doing. Because how often does the do as I say and not as I do sort of strategy really work? Not that often. You might be a karate master in charge of a dojo, in which case I think you're doing great. Keep doing what you're doing. But we all individually have roles that we play in this discussion of our health as a society. I, for one, am optimistic that if we all get on board with this idea that there is a healthier tomorrow and that we can make a way forward for ourselves. I look at things like our efforts to decrease smoking over the last decades. So decades ago, the rate of adult smoking in this country was more than 40%. That number is now down to less than 18%. Clearly, that needs to continue to go down, but millions of lives and billions of dollars have been saved because of that initiative. Our children today do not have to fear infection with things like smallpox and polio because we have treatment for preventing those infections from happening before they happen. We have improved the safety of our automobiles and our workplaces and our food supply chain. So I look at these types of things and cannot help but think, if this is what we have been able to do, that we really do have what it takes to move forward. And I spend a lot of time interacting face-to-face with people in clinic as well, and on a personal level, I am also convinced that I've seen people have what it takes to improve health. The people who, with a new diagnosis of diabetes, are able to change their diet, maybe make a few tweaks in their lifestyle, and then they watch the diabetes melt away, controlled without any need of medications. Or to bring up Gus for one more time, that he spent a month in the hospital after his heart stopped. I don't blame him. That's a pretty monumentous event. But after being out of the hospital, I've been seeing him every 6 weeks, and he's got a good regimen of inhalers for his lung disease, and he is actually doing relatively well. The young people who I take care of who are addicted to opiate medications, who through our medical treatments and counseling are able to regain productive places in society. And so I see these people, these individuals on a face-to-face basis, and also see what we have been capable of. And I'm convinced that if we are all on board, that we do have what it takes to help our society become healthier overall and fix this healthcare crisis that we're all hearing about. I hope that this discussion has convinced you of two things. The first thing is that I hope that you see yourself as intimately related, not just with your own health, but with the health of those around you and the overall health of our society. We truly are all in this together. And secondly, and more importantly, I hope that you feel empowered from this discussion, empowered to know that you have what it takes to save a life, that you have what it takes to prevent problems before they happen, and to, again, improve the health of you, yourself, your neighbors, and everyone in our community. There will still be times, even when we do everything perfectly, there still will be times when things need to happen in fast motion. And when that does happen, we will still be here. Please pick up the phone and give us a call. We will be there right away. Thank you very much.